Psychoeducation on understanding anxiety. The key points that we are going to discuss in this video are understanding anxiety and its symptoms, treating anxiety, anxiety psychoeducation, which includes Yerkes Dodson and Law, identifying and reacting, challenging negative thought, and relaxation techniques. Everyone has worries and fears, even the rich and famous. Freud argued that anxiety can be adaptive if the discomfort that goes with it motivates people to learn new ways of approaching life's challenges. But the discomfort can be intense. An anxious person may prevent themselves from experiencing positive outcomes of life. The term anxiety is usually defined as diffuse, vague, very unpleasant feeling of fear or apprehension. Symptoms of anxiety. The anxious person worries a lot, particularly about the unknown danger, and they show combinations of symptoms. The common anxiety symptoms are nervousness, tension, feeling tired, dizziness, frequent urination, heart palpitation, feeling faint, breathlessness, sweating, trembling, worry and apprehension, sleeplessness, difficulty in concentrating, hypervigilance. Person suffering from anxiety disorders, intrusive thoughts often take the form of worries about possible future events and outcomes, or catastrophic interpretations of past events that emphasize negative. These intrusive worries and exaggeratedly distressing interpretations are characteristics of the anxiety experience and often seem to have an automatic quality that emanates more from the individuals themselves than from what is going on in their lives. Treating anxiety. There are two important tasks while interpreting and treating anxiety. They are to diminish the maladaptive behavior and to enhance life satisfaction. Along with the other treatment interventions, psychoeducational interventions appear to be helpful for several patients with anxiety disorders. Psychoeducation for anxiety. Psychoeducation is an important aspect of the treatment process by informing individuals about their symptoms, providing motivation for change, and offering treatment options. Psychoeducational intervention is normally based on cognitive behavioral principles and shows better effects on worry symptoms and reduction of anxiety and depressive symptoms. Yerkes Dodson Law. Clients who seek treatment for anxiety often have limited knowledge about their problems. They might know that they are afraid of something and that is the reason for causing anxiety. Others might have a constant feeling of anxiety without really knowing what it's about. It's a good idea to start by discussing triggers or sources of anxiety. After a client has had an opportunity to discuss their anxiety, it will be valuable to help them learn about anxiety in general. Education about the Yerkes Dodson Law, which states that too little or too much anxiety is both harmful and that a person reaches optimal performance on a task with a moderate level of anxiety. This can help a client to understand why they have anxiety and how it is hurting them, and how a certain amount of anxiety can be beneficial. Identifying and reacting. It is important to educate the client about symptoms and common reactions to anxiety. Everyone deals with their emotions differently. For example, tapping feet, pacing, sweating, becoming irritable, thinking about the situation non-stop, insomnia, nausea, nail biting, avoiding anything that will help them to become more aware when they are experiencing anxiety. Challenging negative thoughts. Clients need to understand the relationship between thoughts, feelings, and behaviors. Practicing the identification of thought and maintaining a thought log would help them in recognizing their thoughts by asking themselves a series of questions to assess them. This will help them change the old belief and replace it with a new belief. Relaxation techniques. Relaxation skills are techniques that allow a person to initiate a calming response within their body. Some relaxation techniques such as deep breathing and progressive muscle relaxation can be valuable at the moment when confronting something anxiety producing or in general as a way to reduce overall stress. It will be valuable for your clients to practice deep breathing daily even when they're feeling fine because the effects can be long lasting. PMR requires a bit more effort than deep breathing, but it can significantly reduce feelings of anxiety. Using this technique will create a feeling of relaxation, and it will help to teach a client to better recognize when they are experiencing anxiety by recognizing the tension in their muscles. Psychoeducation is a vital first step, but it's important to remember that this is only one part of a complete treatment plan, as learning about your problem can give you the comfort of knowing that you're not alone and that others have found helpful strategies to overcome it. Also, having a better understanding of their problem is a huge step toward recovery. Self-care activity. Maintaining a thought log. Our brains utilize shortcuts on a daily basis, but sometimes we become habituated to twisted views of reality. Our brains convince us of things that aren't true. These are known as cognitive distortions. With practice, we can train ourselves to fight back against these untrue beliefs. This free thought log is useful in challenging patterns of negative thoughts or beliefs. We have shared the link of the thought log in the description below. Famous personalities who have battled anxiety. Kim Kardashian West. In a 2016 episode of Keeping Up with Kardashians, fashion mogul and reality TV icon Kim Kardashian West opened up about her anxiety, particularly around car crashes, and started seeing a therapist. Definitely got a lot more anxiety now just with people knowing your every move. Kardashian West told T, the New York Times style magazine Singapore, in a September 2017 interview. Lady Gaga. I have suffered through depression and anxiety my entire life. I still suffer with it every single day. I just want these kids to know that the depth they feel as human beings are normal. We were born that way. This modern thing where everyone is feeling shallow and less connected, that's not human. Lady Gaga said in an interview, I openly admit to have battled anxiety, and I think a lot of people do. Gaga said in a 2016 interview with The Mirror. Let's talk about mental health. Living with mental illness is not easy. It's a consistent problem without a clear solution. While treatments like medication and psychotherapy are incredibly helpful, sometimes people experiencing mental health conditions need to do more day in and day out to feel good or even just okay. Your story can inspire thousands towards the path of healing. We at Healthy Minds encourage people to come up and be the part to break the stigma around mental health. For more educational videos on psychoeducation, please subscribe to our channel, and if you think it helped you in some way, then please like our video and comment below your story. Share with others who will benefit from this video.